you guys are ready, you may start.
The impact unique stressors have on the mental health of athletes. Our argument was athletes are subjected to extreme amounts of pressure leading to a decline in their mental health. The argument helps reflect that athletes face intense pressure from coaches, schools, families, and competition, which significantly harms their mental health. Constant performance expectations creates chronic stress, anxiety, and fear of failure. This pressure culture discourages athletes from seeking help, reinforcing stigma around mental health as a result. Many athletes experience burnouts, depression, and long-term psychological strain that affects both performance and their well-being. For our background, one of them was performance anxiety. With performance anxiety, athletes often experience intense fear of failure and constant pressure to perform, leading to chronic stress and decreased confidence. Over time, this anxiety can impair focus, decision-making, and overall performance. Our second one was substance abuse. This affects many athletes because substance abuse is turned to as a coping mechanism to manage stress, pain, or emotional pressure. This behavior increases the risk of addiction and long-term mental and physical health consequences. Our last form of background information was injuries. Injuries can cause significant psychological distress by threatening an athlete's identity, future opportunities, and sense of purpose. The recovery process often leads to isolation, depression, and anxiety due from a separation of a sport and support systems.
As we've established, the pressure these athletes face can lead to severe anxiety, burnout, and depression. Our first evidence-based solution is clinical support, such as cognitive behavioral therapy, also known as CBT, sports psychologists, and licensed counselors, all which address specific issues like performance anxiety and depression. CBT helps to identify these challenges that the athletes face and give them a good sense and replace with healthier, productive thoughts as well as coping mechanisms. According to Cleveland Clinic, CBT has been proven effective, and because of the way that these athletes think due to their pressure, Solution 1 tolerates and targets the root cause of these challenges. Clinical support has several important implications. Although it may seem expensive, it is cost-effective in the long run. Addressing these mental health issues early on can prevent burnout, withdrawal from the sport, and decrease performance. Evidence-based research shows that untreated anxiety impacts performance outcomes. Another implication is coping techniques. These coping techniques, Mayo Clinic shares that CBT gives coping strategies which can extend far beyond their sports. It can go into their careers, academics, as well as their social life. Another implication is some of that these clinical support can be short-term. CBT is structured as short-term and only lasts a limited number of sessions, which is realistic for these athletes due to their demanding schedules. Some of our limitations that come along with clinical support is time constraint. Due to these athletes' demanding schedules with their training, traveling, academics, and games, consistent therapy is difficult. Another limitation is effective variability. Therapy is not a one-size-fits-all. Different athletes respond differently to different treatment approaches. And lastly, confidentiality concern. In Simon N. Rice's research, it is found that stigma and concerns about confidentiality prevent athletes from seeking the support that they need.
Okay, so for our group's second solution, we came up with education programs. So essentially, these are mandatory workshops for both athletes and coaches on mental health literacy and recognizing early signs of distress. So as far as the mental health literacy goes, when athletes are trying to learn about their mental disorders, there can be a lot of really complicated terms thrown at them, and that can be really overwhelming, and they don't always understand fully what's going on with them in their mental disorder. So obviously, if they don't understand what's going on with them, they're not going to know anything or what to do about it, which is problematic. And sports psychologists or therapists would help them recognize early signs of distress. Like if they're experiencing extreme anxiety, they could learn how to detect that earlier, and they can stop it before it gets to a point that's really detrimental to their health. And this information comes from an article published by Mental Health First Aid in collaboration with the National Collegiate Athletic Association, which was managed by the National Council for Mental Wellbeing, which is a top-rated nonprofit organization. Okay, so for some more implications, the biggest one is that it reduces stigma. So surrounding mental health, and particularly mental health in athletes, there's a large stigma surrounding mental health because A lot of fans or viewers of sports look at athletes and they idolize them and they're often seen as invincible in a way. And a lot of athletes are really scared of being seen as weak because they have a mental illness, and this would help reduce that. And also, another one of their implications is that it would build resilience within athletes. So they would learn, once again, how to better cope with their illness, which is going to make them stronger as a person. And to go along with reducing stigma, it would help improve help-seeking behaviors. So if athletes are really fearful of being seen as weak, they're obviously not going to reach out in a way that's going to be effective for them. So this would help them be more accepting of the fact that reaching out for help from these sports psychologists or even like a coach or something like that, it would be okay, and it's not going to make you seem weak as a person. And this information comes from an article published by Kelsey Griffith, who is the lead clinician at the Michelle Center for Sports Injury Prevention through Boston Children's Hospital. So for some of our limitations, like Carly discussed earlier, they have pro and collegiate athletes have really demanding schedules, like they're traveling all over the country to compete, and then like practices and film sessions are really demanding as well. And collegiate athletes on top of that would be attending classes at their university. So it would be really difficult to find a time where they could all come together and discuss mental health. And the amount of time, it would probably be a significant amount of time that they would need to discuss such an important issue like this. It would be really hard to find a good time. And once again, the fear of being perceived as weak, so the stigma, a lot of athletes would probably be pretty hesitant to want to be a part of a program like this because they don't want to be seen as weak by their fans, family, whoever. And this comes from an article published by Julian Yoon, who has a master's of education and is a researcher in the Department of Psychology at the University of North Texas. So in conclusion, the solutions like cognitive behavioral therapy and education programs and mental health of athletes will improve over time. And once again, going back to stigma, I think that would be the biggest factor in helping mental health in athletes improve over time, because if athletes are still scared to reach out, they're not going to be able to do anything about it. And obviously, stigma probably isn't going to ever fully go away, but if it's reduced, it can help over time.
All right. Let's look at a couple of questions here. All right, Haley. How did the group decide to include Carly's perspective, lens, or conclusions into the overall presentation?
We decided to use Carly's lens, which was the social aspect. We decided to use that because hers talked a lot about like going back to CBT. That was more in her paper, talking about how they went to that cognitive behavioral therapy, of how that can help them express and not be stuck in such a hard mental state when dealing with sports.
Okay. Carly, reflecting on your colleagues' work, which one had the greatest impact on your overall understanding of the problem that the group identified?
Reflecting on my colleagues' work, I would definitely say Caroline's ethical lens had a good overall inspiration on our paper and our presentation. She spoke a lot on the stigma on athletes and how it can prevent them from reaching out for the help that they need to deal with this pressure and depression from the sports that they're in, which was included in our presentation quite frequently.
All right. And then, Caroline, what is a way in which your team's resolution makes you think differently about your own individual research?
So I think our resolution, like with the cognitive behavioral therapy, I think it made me think a little bit about, I didn't know, like I was aware of how much pressure athletes are under just because I'm an athlete myself, but obviously not at that high level. But I think it was a lot easier for me to see that there should be more effective and easier ways for athletes to be able to receive help, and I don't understand why it's not implemented, because it's such a big issue. Like, it can affect the athletes for the rest of their lives.
All right, good job.